recording virtual meeting statement pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, subsection 18, the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Hubbardston Board of Health will be conducted via remote participation to the greatest extent possible. Specific information in the general guidelines for remote participation by the members of the public and/or parties with a right and/or requirement to attend this meeting can be found at www.hubbardstonma.us. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event we are unable to do so, despite best efforts, we will post on the town's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible. All right, now it's all yours. Oh, there's Kathy.
Oh, good.
Okay.
I don't see her yet.
Nope, there she is.
There she is.
Hi, sorry.
Good morning, Kathy.
Can you hear me?
Yep.
Okay.
Morning.
Good morning. I was looking for it on my Zoom, on the Chromebook, but it wasn't sent there, so sorry. I had to pull it up on the other computer. So, no worries. Judy, I'll let you run the meeting if you want. Fine with me.
Yeah, okay. I'll start anyway. One of the first things that I think we need to discuss is this agreement that was sent out over the weekend concerning setting up clinics for EMS and other first responders, police, fire, etc. And they were requesting that we be able to do 200. Well, first of all, we don't even have 200 first responders. We're a small town. Again, this is another document that came out without thinking about the little towns like Hubbardston and Oakham and New Braintree and folks like that. So, but anyway, it's Rutland has taken some of their CARE Act money, and I guess they've been approved to be able to get a freezer that's capable of handling the Pfizer, and then they've also got a refrigerator that's capable of handling the Moderna. And so in order to get the 200, meet the minimum of being able to set up clinics to vaccinate our first responders, the town has the option of, quote, regionalizing. They have the capability of handling insurance because they've done it before. They are also tied into the MIIS system for recording, and Rich Stevens is EMT, and he has taken the ball and he is running with it, and he's been trying to get a collection of up to 20 different towns to be able to get this freezer and get the vaccine stock. So he has invited Hubbardston to formally sign on. It has to be by December 23rd. He has to file this paperwork by December 23rd. So he's really pushing that either health agents or boards of health sign on, and that way, at least, even if we don't do a clinic, we've got the capability, and so that's a plus for us. So it would be basically, I think we would basically be running like a satellite clinic, or technically a satellite clinic. In other words, they would be the primary distributor, and then it would satellite out to Hubbardston. So Barry has, when, I think Kathy, you're going on Wednesday to Barry's walkthrough. Also, Hardwick, New Braintree, and Oakham are also going to be there. So they're going to be doing a walkthrough as well. So that may be a primary clinic, but then we always have to think of additional satellite clinics and all that stuff. So we're going in like two different directions at the same time. So one is working with Rutland for distribution, and the second one is tying in to a potential regional clinic at Quabbin. They're both good options, but it doesn't eliminate having smaller clinics here in Hubbardston. So that's where we're at this present moment. The first thing I think we need to decide is, do we want to sign on with Rutland for, so that they're for storage of the Moderna and storage of the Pfizer, and sign on for a small clinic for our EMS folks and our police and fire. It's free.
Yes,
Yeah,
I think it's a good idea to combine with Rutland. That way we don't have to buy freezers and refrigerators. I have a couple super duper coolers for transport that I personally own and had used in the past for the farm, but they've been sitting in my basement now for 3 years unused, and they're the really heavy duty ones and big. So I have 2 of those. So that would help for transport for the short term for small clinics. And I'll donate them to the town, or we can use them and then sterilize them, use them, and then return them, whatever people want to do.
Yeah. Rutland also said the freezer comes with a couple of transport tubs as well. So sounds good.
That would help.
Yeah. The small clinics we could probably handle, like, for the seniors, for the EMS, we could probably handle that with just the nurses that are in town. Kathy Waldy, I'm sure, would jump in and help. Lois Tyler, so I know there's a number of nurses that would jump in. Tammy Wiley would probably come over from Rutland, as with Desiree and Peg Sullivan. So they're kind of my regulars for doing clinics, but they would probably jump over, so we could handle small satellite clinics easily.
What kind of timetable are we looking at? I mean, are we way down on the list, or is this imminent in the next week or two?
The EMS is imminent. They're trying to get all their first responders done, and then they can move on to the next level. Our seniors are probably March, but I don't know if Johnson & Johnson and AstraZeneca will be out, or any of the others. I know there's Sanofi's out there as well. I don't know about Novartis. Those are kind of your main folks that handle vaccines.
does this mean that Rutland has like a doctor who will order the vaccine for them, or?
They do have a medical director, but this is all coming from the state, so all the orders and everything are going to be signed off on the state level.
Okay.
We are supposed to be getting, they're supposed to be providing syringes and needles. I think they have a contract with McKesson. I was at Orange over the weekend, and they had the McKesson needles. That'll probably be a nightmare for the nurses, but it's not anything we can't handle.
Great. It would be
Do
silly
we
not
have
to.
any kind of medical director?
I found an old folder that had Chris Stoddard, but he was only approving pediatric vaccine for the flu shot in 2011.
That's really old.
Yeah.
I can ask Dr. Gracie, or I can ask, I know Stacy Potts, who works out of the Barry Health Center, took on the medical director for Orange.
Okay.
So I have 2 or 3 doctors in the area who have signed on to the MRC. I can just send out an appeal to them.
Okay.
So the question is, do we want to sign on with Rutland? Yay or
Yeah.
nay?
So if we sign on with Rutland, we need a space of our own to administer this. We need our own staff, volunteer staff, and support groups for them, correct?
Well, it would be a small enough clinic. I mean, you're only dealing with police, fire, and EMS. So, yeah, you
I mean,
need a
I'm not saying
space.
it's a problem, but that's what we need.
Right.
And
Yeah.
then the timetable is fairly reasonable at this point because we're not going to get it.
Right.
Okay.
And you said that Rich has access to MIIS, so he could, or someone in that group does?
Yes, Lynn has been actually doing it, and she's not an RN,
Great.
but she's actually been tied into the system. I'm not quite sure why we have this crazy, I was talking with Jamie the other day, and she said that, they did a spreadsheet, Excel, and then she turned it over to UMass because they had the RN to put it into the system. That's just a crazy system. I don't know why anybody can,
Yeah, it would make it a lot easier if one of us could do it, but.
Right, a medical assistant, or in a doctor's office, what's the difference between a medical assistant in a doctor's office and the Board of Health clerk?
Right.
It doesn't. It's kind of crazy. But there are ways of working around that if we need to.
Okay. I just want to make sure we're doing everything.
Yeah.
We
And
need
we
to.
can also, and I talked to Sandy too when I was at the Gardner EDS drill, and Sandy said that she would be very interested in jumping on board and helping out as well. And if her name is on the MIIS, that may be something she
Yeah.
take on for the town.
Okay.
We'll have to
Great.
sweet talk her. So you want me to go ahead and tell Rich to sign us up?
I say yes. Vinny, what do you say?
That'd be fine. I'm not opposed to either option. I think whatever's going to be the quicker would be the best. But
Colleen, what do you say?
I'm with it. That's fine.
I'll let Rich know today then.
Thank you.
All right. The second thing that's worrying me is the EDS. I've been to like 4 different drills right in the last 3 weeks. Gardner is planning on doing at the high school an outdoor drive-through clinic. And Rutland is also setting up a drive-through plans as well. They're going to be using their middle school drive, and Gardner's going to use the high school because it has that loop through in front of the school. We have a nice drive-through loop in the elementary school, but here's the fly in the ointment. You need to sit for 15 minutes after you get any one of these drugs, because these are all brand new. Even if we go with the AstraZeneca or the Johnson & Johnson, it's all still going to be brand new. So we need to have everybody sit for 15 minutes to make sure that they're not going to do anything funky. So that we don't have, if you look at that school loop where the parking lot is, if people are driving around getting their shot, and then how many spaces do we have for them to sit?
Are they able to sit in their vehicles, or do we have to provide them a spot to sit?
No, they're able to sit in the vehicles. But, you know, a drive-through clinic can go fairly quickly. You can get, if you have different teams, so you have like a greeting team that says, this is, you know, have you had COVID symptoms, et cetera, in the last 2 weeks? Because you really don't want to give anything to somebody who's potentially going to be ill. So you need to screen them right up front. And then there's another, they move down to another station where they get registered, or if they brought in their registration, if we put it online, then, you know, that's reviewed and cleared. And then you, if you want to do insurance, you know, if you're going to be doing insurance issues, that's the next job. And then, although COVID is supposed to be free, you know, the COVID vaccines are supposed to be free to everybody. So that's probably not going to be a problem. And then, so you've got your screening for COVID. And then if they pass that, then they move down and they're screening for allergies, you know, like for instance, the Johnson & Johnson may be using eggs to incubate their vaccine. And if that's the case, so, you know, just like in influenza, if you're allergic to eggs, then you're not really recommended to take it. So that will go down. So you're screening for allergies and making sure, you know, everything's permission's been signed off and everything. And then you're going to move the car down to the injection. And then you're going to need to go and sit for 15 minutes. So we're really, if you have two teams, one on each side of the car, so you have, well, it works best is to have somebody draw it up, draw up the vaccine, and then the nurses, one on either side of the car, will administer and sign off. And then you also get a piece of paper. There will be little cards that everybody gets that says that you received the COVID vaccine. So, I mean, although that paperwork has to be signed off. And then, so you're talking teams, 2 teams at the greeting and 2 teams at the screening and 2 teams at the injection. And then you've got to have another team that's going to wander from car to car, checking on everybody. So, but it's still going to go fairly quickly, because we went through 50 cars in Royalston in pretty short order. It was like less than an hour. We had 50 cars through. So
There's not, is there?
I can't see, you know, we could easily have 50 cars in an hour. Where you're going to put 50 cars in that parking lot?
Is there a parking lot that loop dumps out into, or no?
It's that small parking lot in front of the playground.
Oh.
Well, depending on what day this is held, you may be able to use the parking lot in front of the police station. They can swing up there, and you can have another team. It's just 2 more people up there. If we had overflow. I can't think of another big place in that area that you could actually park cars like that and have it controlled.
Right.
I don't think there's any other place. It has to be right in that area. It has to be right there, you know.
And the other thought is to we'll continue to work on that problem, but then the second thought is just to have it in the gym.
We had talked previously about scheduling people for these clinics.
Mhm.
So if our parking space is no more than, say, 35 per hour, Maybe that's how we run it, as a drive-through, limited to 35 cars per hour.
Yeah, and that way,
That way you
And-
have the parking spaces, you can still drive through. We'll have to use a lot of cones, but it'll work. To
Could,
have, double places for people to park with the help of the police. Maybe they could help that way. And limit just that we don't run out of parking spaces in that hour.
Yeah.
And then
Could
the
be-
next group could come in after that.
Well, the other thing is too, is if you're gonna have it outside, where are these cars gonna line up? On Elm Street?
yeah,
Or are they
Elm
gonna
and
back
back
up
around
on
the
Main
corner.
Street?
Yeah.
I mean, you're gonna have to have police there. You
Right.
can't do that. I mean, they're a
Right.
big, that's a big tractor trailer road right there, and, I mean, and that intersection is a horror show.
And you also have the school system school going, so you might need to do it on a weekend.
Well, that's the other thing too, Vinny. I was thinking about that while we were talking, using the gym and stuff. How does that work? Yeah, with the school. I mean, they take up all those parking spaces. So now you have no parking spaces. You have school going on, unless you're going to do this at, 4 o'clock in the afternoon and then continue into the evening. But now because it's dark early at night and still will be at that point, when you're talking about February and March, you're still going to have cars parked down Elm Street. And there's no lights.
right.
So,
So,
yeah, I
we're
mean, I just
really
don't know how
looking-
this is going to work.
yeah, so we're realistically, we're looking at, trying to start clinics somewhere late March, early April. At least that's the plans right now.
Judy,
Um,
could we use the loop in the town hall and just utilize the gym and have people do that loop and use the parking up there? If it's during school hours, then maybe just not use the gym for the day, or is there
Well,
enough?
for the big clinics like this, I can contact Jill, the principal, and see if they can dismiss school at half a day or something. For the first clinic that we need to have for the EMS and police and staff, we could probably do that through the regular parking lot where the police station and employees park.
We
Because there
could-
aren't
does
that
that
many.
doesn't have to be a
numbers.
drive-through though. We just
Do you think
in-house,
we
right?
can make it as a drive-through or not, Mallory?
I don't know if we don't have that many EMS and fire staff, that I don't know if it would need to be a drive-through for that part.
hmm,
They're all here anyway, so I mean,
Oh.
fire's in their own building, but
How about if for that, you used, fire station number 2 up Gardner Road?
The problem with that is the vet clinic there. Their parking in the back gets very busy with the vet.
I'm sure that we could schedule out the fire and the EMS at different increments, so they come in groups, groups of 2 or 3, they get them, wait there 15 minutes, the next group comes in.
right, and at that place, there is a conference room, so then we could.
Yeah.
fit-
And a
on-
lot of our staff for fire and EMS are also not just Hubbardston, there are other towns too. They work in multiple towns. So there's a lot of staff that might not need them. I know some staff has already got them, and Haywood's calling in apparently other towns, so if they get them beforehand, I don't know how many vaccines we would have. So I think the conference room would definitely, we can make that work.
Okay,
Well, I think before we make any of these plans, this is good discussion, but I think what we need to do is come up with a list of EMS, fire, police that are going to be needing it, get a
Right, of
number,
course.
and then figure out where we can have the location. I have my reservations about drive-through, whether it be with the professionals or with the residents, especially if we have an incident where somebody has a reaction. Now you're gonna have to have the EMTs and the ambulance. That's gonna
Yep.
really throw a big clog into into the cycle of people moving.
Right.
And, you know, it's going to be difficult servicing or assisting those people if they're in a vehicle. So I
Right.
think we may want to really consider the gymnasium, which was already set up, for instance, for voting. We have a system where they can go in and out with 2 different doors and move through it fairly quickly. And
Mhm.
medical assistance would be done right there without any interruption. And, you know, you'd have a section set up for the rare person that may have a problem with it. And,
And that's how we did that's how we did the drill last time too, Vin, is we kind of went through if we had a clinic inside the gym. So there is like a map already made and all that good stuff too.
Yeah, and that was what I've been thinking about too. Is like, I'm not sure that we could actually do any kind of drive-through. I mean, it's nice if we have plans, but you know, I think the reality is the gym is probably the better option for us, an indoor clinic.
especially
Well, you have plenty of room for them to sit down for 15 minutes.
Correct. We'll pull out the bleachers and have them
Yeah.
sit.
Rope them off, like you, okay, 15 minutes, and then these people, then you have another roped off area where the next group of, you know, you do it in like 5-minute increments or something like that, where they, you know who's been there for 15 minutes or
And
something
once
like
we
that.
get to that point, we can set up little satellite clinics like they call them closed pods. But anyway, those are just like little satellite clinics. So we can set one up, you know, we can contact the group homes that we have here. I'm sure they're tied in, but just in case one of them has not received the vaccine, we can contact them and send 2 nurses or and a cert volunteer out there. And then the other thing, we can go down to the Hubbardston House and vaccinate right there
Right.
as
Well,
well.
that's a good thought. That would take care of a lot of the seniors right there. But I think what we're doing here, as Vinny said, this is a great meeting, throwing stuff around and back and forth. But maybe we should really be prioritizing the fire police today and figuring out how we're going to do that, because that is the imminent thing. And if we're going to do it in the gym, so be it. If you want to do a drive-through, we'll have to come up with a lot of people, a lot of space. So what do you think, Judy? I mean, you know, maybe we can just get this figured out today about the first responders. We got a lot of good ideas for everybody else, like going down to the senior housing. I think that's a great idea. Instead of dragging them all up here, go to them. You know, and a lot of them don't have any qualms about going down there because they have friends down there, other seniors in town.
Yeah.
You know, and it's I've never been in there before, but is that bigger than the senior center?
They have a small conference room, but they also have a large dining area, which they never use because they never got the license for serving meals on site. But it is a large dining area, and it has doors from the outside, so they can go in one way and from off the porch come in and then go right out the front door.
Or and also they can do that, but before they exit the building, they can sit maybe in the conference room for their 15 minutes.
Mm-hmm. And have coffee and donuts.
I'm a senior. Can I do that? I'll be there.
Okay.
Yeah. So, I mean, if we can just figure out the most imminent thing is the first responders. I mean, if we can do that right down here, you know, I don't know. It just seems there's so much going on here.
I like the idea of setting it up in town for the first responders. That would be giving us an opportunity to have a practice run. We could set it up the way we want to set it up for the community, so we knew what we were doing. On the other hand, would it be more efficacious to do a regional system? Could we piggyback with Rutland's efforts or the Quabbin's efforts, so that the first responders who are much more mobile would go there and get it over with faster and and out of the way.
I think Rich Stevens would be, would have no problems whatsoever if they open up a clinic in Rutland. Then I think they would invite all the towns that have signed on to use the for vaccines to be stored in their freezer. I don't think he'd have any problem also inviting them to come to any clinic they set up.
Well, I think that may be a better way to go to get it over with as soon as possible, because clearly we're going to have some logistical problems in this town that they are better able to solve for a regional effort. And that way we get the vaccines for the first responders sooner.
Yep.
But we do have some time to figure out our logistics for the regular community vaccinations if we do it that way.
And I'm not in favor of going regional for residential because,
I agree. Yeah.
yeah,
All right.
I had some years ago, around the time H1N1, I can't remember the year. Sandy Knight was on the regional committee to look at that as a regional clinic, because the state was bugging everybody to put together regional plans. So she did. She went and the plan was to have everybody in Hubbardston go down to to Quabbin and then come back. And you just can't have 1,000 cars from 5 different communities all descending at the same time. So the thought was, they'll just, and it's still in the EDS plans. If you take a look at the copy that I sent out, it's still in there to A through C will come at this time, and D through F will come at this time. And, and I said to her, I said, so if you're going to go neighborhood by neighborhood or alphabet, so you're going to contact so-and-so who's like a W, last name begins with W, to come down to the Quabbin Regional at 2 a.m. in the morning with all their kids and everything. And then, the plan at that time was to have them come down to Hubbardston School, get on a bus. The bus would take them to Quabbin, and then Quabbin, and then they come back, get on the bus, and come back to Hubbardston. But there was this thought about having it. Everybody was going to get vaccinated in 24 to 48 hours. So they had this alphabet list and was going to go 24/7, and it was a crazy plan. So from that point, I've never been in favor of regional because the logistics are just a nightmare. I think Vinny can probably speak to that. The logistics would be a flipping nightmare to get everybody over there.
Oh, it's going to be a
Correct.
nightmare.
And
just
it's
to have
an
it
endangerment under the guidelines of COVID of staying 6 feet apart.
Right.
So I think that, Vinny, you're right. The first priority is to get information on our first responders and police in town. Kate was going to set up an Excel sheet. So Mallory, I think the action plan to do that is, Mallory, we need to get a list of names and phone numbers of the staff in town, answering also if they've already gotten a vaccine and where and when, so that this can all be entered into our town's Excel database. And then ask them yes or no, they'll be willing to drive to Rutland for the clinic. So there's some information that we need for that. If the answer to all of this is no, they don't want to drive to Rutland, then we need to set up a clinic here in town. And if the conference room over by the other unit is a good place to do it. Yeah, there's parking in the front that everybody could park at. people could schedule and we could set up a schedule to do it there. So
Judy,
then the second
do we
one,
know if Rutland,
Pardon?
I'm sorry,
do they
Mallory?
have a date for their responders?
No, they don't have a date. They're still in planning. The state hasn't issued it yet. But they want everybody to have plans.
Yeah, our chief of police was just in here, so he was asked, that's why he was in here to ask me if we had a date yet, so.
Okay, so then I do like your ideas of having possibly a clinic at the Hub House for all the seniors, because they're going to be the next group. And then, like you said, a third clinic for the general population in the gym at the elementary school, so that we have spacing. And there is adequate space to do it there for later on. That's what I'm hearing everybody saying. Does everybody agree with that?
Yeah, sounds good.
Yep, I think it sounds good too.
Well, I just saw some statistics recently. I think it was with the email that they sent around for a survey showing that the senior citizens in town, and I don't know what their description of senior is, what age group they're talking about, was under 500 people, I believe. And if we break that down even further for 75 and older or 74 and older, that should make it a fairly manageable group for the first inoculations and a good run through depending on where you want it or where you want it. And if it's at the Hub House, that's fine. If it's up here in town, that's okay too. But then we have to work on the logistics of doing it. And one of the questions I would have is, would all the people involved in the clinic have to be vaccinated before the clinic? So that if you're participating, whether it's just with paperwork or with administering it, would they need the vaccinations before the clinic? And if so, where would we get that? Or where would those people get that? And I mean, these are some of the thoughts I'm having that need to be worked on before we can have any definite plans for a clinic. Where is easy compared to some of the other stuff, and how many people are going to volunteer for it, and timing, and setting up the community so it's not a complete traffic jam or a disruption of the school. It's going to be interesting. There's going to be some decisions to be made. But
Well, if you're talking MRC, 60-70% of my volunteers are already working at a hospital or long-term care. So
that's good.
they're probably going to come in with already vaccinated. My understanding is that anybody who does work at a clinic, they can get their vaccine right up front. And so that would be CERT, that would be any MRC, that would be any town residents who choose to, and they would have to be quarried incidentally, but we could take in a volunteer, we could develop a volunteer group specific to our town. And they would be eligible to get a vaccine first as well.
would it be too early to set that kind of list up so that they could also participate? If we go a regional system for the first responders, clinic volunteers could get involved in that one as well to solve that problem?
That's what I was thinking, Vinny. I
can
agree.
explore
They should
that.
get, yeah. If there's enough doses to get our volunteers done at the same time as the first responders, that would be good.
Okay. I will ask that question.
You also mentioned about people getting quarried. How long does that take?
If you go through the police station, it should be instantaneously.
Oh, okay. Oh, all right.
If you go through the MRC, I can get it and I get their application and it's all filled out. I can, in their quarry permit, I can get it done in 24 hours.
Oh, okay.
Um, So the next thing that on my list was Jamie would like to come and walk through again. It's one of those annual events where we walk through. Um, and I think we
Right.
probably need to look at, well, what did we do last year? And then what modifications do we need to do to make to last year's plan?
Well, I think that would probably be kind of easy this year because since we did it last year and there wasn't any, this virus wasn't around last year.
Right.
I mean, how odd is this to happen that when we did that and now here it is.
Right.
But I think that now that we've had this meeting and we've talked about specific things that we'd like to do that walkthrough down here at the hub school for the gym. Now we've actually got, we're focused in on what to do. So
Mhm.
all we'd have to do is look around and say, okay, so now this is where they're going to come in, they exit. This is a 15-minute wait. I think it would be, I think we'll get a lot more out of it, and it'll be much easier to foresee how this is going to work now that we actually have a plan.
Mhm.
Because last year, I mean,
It was
it was
general. It was
it
very
was
general. Yeah.
it was real general, yeah. And I had never done anything like that before, but now that I did it, and we've had this meeting and we've discussed all this, I think we're all going in there with a better mindset than we had last year.
And she's coming in with each EDS. She keeps bringing in more and more what she hears coming down from DPH. So she'll bring in a lot of different information. One of the things that we probably need to look at is like a sign up. And I guess it's signup.com. And there's also Sign Up Genius. I use Sign Up Genius for MRC, and that works, but I don't know if it'll work for the town, but Mallory or Kate may be better to make a judgment on those kind of systems.
I think
Or-
Kate said she would take over Sign Up
Right.
Genius. 'cause
She was going to do
that.
that. Yep.
Okay. So I know that gets brought up at every EDS. And then they want the stations really spread apart again because of the 6-foot distance issue and everything like that. So I don't know how I haven't seen, the map that you guys drew last year, but that probably needs to be reviewed and maybe just, spread out a little bit more.
Sure.
Think about.
Definitely does need to be spread out.
Another concern we might have to have is the verification of citizenship. Do we need to do any of that in age?
No, at this point, the no documentation for whether you're a citizen or undocumented. It's open to everybody because this is a worldwide project now. And then the second thing is right now it's 16 and above. So they're not doing any vaccinations or planning for any vaccinations of younger than 16. That may change as the other vaccines complete their trials and become available. And so the ones that are the influenza vaccine, targets what they call the spike protein. And that my understanding is some of these that are coming through the trials now are similar to influenza, where it's also targeting this spike protein on this virus. And in that case, we may actually see the vaccine go all the way down to 3.
Now, would the town clerk be able to provide us with census data for age groups? Or could we work with the senior center for a list of folks? before we have the clinic, if we can narrow this down to X number of people 75 and over, it may solve the first problem for the first wave of inoculations of where we have it, how fast it's going to go, how long it's going to be, how many people are going to be needed for volunteers. And I don't know that answer, obviously, but maybe we only have 30 people in town over 75, or maybe we have 300 over 75. That's going to make a difference in how we structure the whole process.
Actually, I do know the answer to that.
Great.
The clerk is actually, should have a whole list with ages, addresses, and telephone numbers. I think that's required of them, because when we had the ice storm, that was, Joyce was able to pull out a whole paper copy, and that's what we worked off of, trying to check up on, make sure everybody was safe and nobody was sitting in a cold house. So yes, the clerk should have a paper copy of that available.
Then we would probably be wise to contact virtually everybody that we can to make sure they have transportation. We may have to arrange transportation for them.
Right.
If necessary.
Yeah.
Yeah, there's a lot of little details that we have to consider.
Right. Right. Which is why I was getting nervous.
Yeah, well, I laid awake last night thinking about a method. Maybe we could go by street lists and have everybody, whatever street you live on, assigned a different time to come down and arrange it that way. But I do think we need to know the population we're dealing with, or the number of the population we're dealing with, so that it gives us an idea of how big of a problem it's going to be, especially on that first one.
Yeah. Yeah. So in addition to the EMS folks, a list, we also need to get the list from the clerk for residents. So we can work off of that and setting up clinics. That's a good idea. Work it by age and work your way back down. The one group that's going to be reluctant to get it, that's going to be your working group, your 25 to 45. They're the ones that are going to tell you, oh, I don't need it. I'm healthy. Don't worry about me.
Well. I have an answer to that, but I don't think I'll share it.
So for a walkthrough with Jamie for the EDS.
Yep.
Last year we did it at 3:30 after the school was closed.
Okay.
So I can contact Jill Peterson. If I'm looking at our next month's calendar here, maybe Monday, January 11th, would that be too soon? At 3:30? The next day we would have our Board of Health meeting and talk about any glitches.
Okay.
Okay. Sounds like a good plan.
So I will contact Jill. Judy, can you contact Jamie?
Yes. Yep.
All right. So let's propose Monday. I'm writing this down, sorry. January 11th, 3:30. And we'll meet at the elementary school entrance.
Okay.
Mallory, I will come by earlier that day. We'll pull out all the posters and things that we do have.
Great.
And things like that.
Okay, sounds good.
And there's some, and I'll see if I can get into the trailer. I know Colleen and I were going to go back down to the trailer and take a look inside. I did pull the what I knew was to be Board of Health supplies, and that's on a separate shelf in there, and it can stay there. Down the road, if we want to do once we hear a little bit more, I would suggest that we also consider purchasing a small refrigerator. It doesn't have to be big, but something that we can monitor. Mallory, can we confiscate that closet in the, that I showed you earlier?
Might be able to.
Remember, and as you walk into the library building there on the, right across there, there's that storage area, that
Yeah.
storage.
I think the clerk had some of her documents in it, but we might be able to get her to move some of this stuff.
Yeah, because we should, at one point that was Board of Health storage. So
Um,
I would love to confiscate it back, but,
Um,
but,
Second idea, the old Board of Health office, is it being used right now, Mallory?
Yeah, by Mart.
It is, okay, they did take it, okay.
so, but that would give us, space for, supplies that if we don't want to keep them down at the trailer, but the trailer's got plenty of space too, but, there may be supplies and a small refrigerator in there for like coming down the line for, the AstraZeneca or Johnson & Johnson, which will only need a refrigerator, temperature.
Oh, good.
Is that, are they maintaining that trailer with snow removal? Can you get near
As
the
best-
trailer? Let
Can
me
we
put it
get to
that
the
way.
trailer?
Because can you get near that
Is it
trailer,
cleared
Judy?
out?
Because I'll tell you
More or
what,
less, Dennis says.
yeah. I'm just wondering, because I was thinking when you and I were going on there, we'll never get near that trailer. It's probably frozen.
Probably.
Yeah,
In regards to a refrigerator, I will ask Jill at the school if they have a refrigerator they are not currently using for the clinic day for storage in the kitchen area. I think that when we did the inspections, that they indicated that there is an area that is not being used.
okay.
So I'll ask that question.
So that would be temporary storage while we're
Correct.
while we're running this. Okay. Temp storage. Okay. That's an interesting thought. Okay, I hadn't thought of that. So that's what I just wanted to get things rolling because, things are gonna climb up on us real fast. And I did print out, the final copy. So I will, as soon as I can get down there, someday this week, I'll drop off the paper copy so that our board will have a paper copy.
Judy, I'm gonna be on vacation until the 4th.
Okay,
I'll still check my emails and stuff, but you don't have to rush down here. But if you want to leave it in the silver box in like an envelope, someone will get it and put it into the Slade building for us.
okay. Wow, it's a
Clerk
big,
is out.
it's a big binder.
Oh, okay, yeah. So either they can take it across the Slade building and hold on to it, or if you want to wait, it's up to you.
All right. But it's done. I just wanted to let you know that it's
Yay.
done. And I'll start taking a look at all those checklists that are, when I sent out a digital copy and there's a bunch of checklists, but that's our next step is also start taking a look at all those checklists and pull out the ones that we want to definitely use as we're going through this whole season. And then they're talking about the season of vaccines going as long as into August.
Well, there's a second round, right? So
Well,
if you get vaccinated now, I mean,
21
do this
days later,
twice?
another clinic. Yep.
yeah,
that's if you're using Pfizer. 28 days if you're using Moderna. The other, for the residents, when they come out with the others, that will be one shot only. So that's the good news. And the other thing is too, one of the things that came out is that, you have that timetable for getting that second shot for Pfizer and Moderna. You only have a 4-day window. So if you miss it on that 21st day, you only have 3 days left after that in which to get the shot. And then otherwise, if you miss it totally, and you don't come back for that second one, you have to start all over again. So that's one thing that we need to get that message out to the EMS and police and fire. It's like,
And we have to schedule an extra clinic session.
right. So you have to come back, on the day that we're holding the clinic, and there's no ifs, ands, or buts about it, or you're gonna have to start all over.
Well, you just said there was a 4-day window. So that means that if they don't say however many days they have and they miss that day, they have 4 days after that they can get the vaccine.
Yeah,
Is that what is that what you meant?
Day one would be the 21st day, and then they have 3 days after that in which to get so I mean, if you schedule the clinic on day 22, from the last time you had it, then they need to come on that day. But once you get past day 24, since the last one, then you have to start all over.
Well,
So there's
So
a narrow
does-
window.
yeah, so does this mean that we have the clinic? How long are we going to run this clinic for? So the first shots we're going to give,
Right,
is that just 1 day?
that's 1 day.
Okay,
And
and
you gotta
then
come back 21 days later.
no, but I mean, are we just going to do this 1 day and have
No.
everybody come? Or are we going to have this, is this going to be like 3 days we're going to run the clinic so people can come get their first shot?
That's the thing. So if they get their first shot, and then we set up a time and another day for coming and getting their second shot, because it's only about 50% coverage after the first one. And if you want to get to the 95% coverage, then you need to come on for that second clinic, for that second shot. And I don't, for us to accommodate them by having 3 or 4 clinics available to them is ridiculous. So you come, if we set it up on day 21, then it's your responsibility to come and get that second shot. Otherwise, you're going to have to find another way to get that second shot within that 4-day time period.
Okay, but I think what I'm saying is, I hear what you're saying, but what I'm saying is, so let's
What
say,
are our numbers gonna be? Yeah.
yeah, so are we going to be able, so if we set up the clinic at 3:30 in the afternoon on a Wednesday after the school's closed to use the gym, are we going to run the clinic till for 24 hours to get all of these people that we're going to get in, or are we going to be running the clinic for 6 hours for 4 days?
Moderna and Pfizer right now is only available to EMS, so you'd only be talking right now to your professionals, about your professionals.
No, but how about after that?
Yeah, the residents will be more like April, and I agree with Kathy that we should run these clinics on a Saturday, and that we should, and I wouldn't go any more than 8 hours.
Okay, no, because then the reason why I'm saying that is because if you're going to run it for a couple of days in a row,
Right.
that's you have to have the people to do it.
Right.
You say, we've got all these teams set up.
Correct.
Now we're going
Correct.
to have teams set up, and some people won't be able to participate on a Sunday or maybe whatever. So now
Mhm.
you have to think about that.
Right.
Right.
That's the nightmare of this planning.
Oh, I'm so glad I'm in this nightmare.
Well, whoever's taking notes, please make a note of the fact we'll have to have some type of paperwork for disclaimers so that they are aware that they have to come back at whatever date they have to come
Yeah.
back at, and it's going to be their responsibility. If they don't come back, then,
Right.
but they have to be,
Right.
I think, made aware of that. That's going to be a technicality we don't
Yep.
want to overlook.
I've already heard them. The news is already talking about that, how if you get the first shot, you have to get the second shot in this many days, however, whatever they
Yeah.
were saying. So the word is out there, but not everybody pays attention to that because the vaccine isn't here yet. So
Well, the only way we're gonna be actually able to verify that people get the notice is when they get their first shot, they get the paperwork and the notification right then and there.
Right.
And from
Well, I
there,
think-
on in, it's up to them.
Oh,
well,
We
they
can't-
have a card. I heard that they were going to give you, you're going to have a card.
Yeah, there's a card.
And
that-
it's going to be
Mhm.
your next date that you're due
Date.
for the second one is going to be on that card.
Correct.
so my girl's dad actually just went this morning. He called him and he got his first dose because he's an EMT responder. And he sent me a picture of the card, and it has all that information on it. Vin, it's actually from the CDC itself. And then there's a nice spot where they put all the information about the vaccine that he was given, the dosage, the lot, all that good stuff, the expiration date. And there's, like you said, Judy, just stickers, Haywood Hospital. And right on it, it says the disclaimer about the second dose and the paperwork that he was given, which is like the information on the vaccine, and all about it's not only has information on the about the vaccine, but also has all the information about the emergency use authorization that was given for this vaccine too. So I think we'll probably have access to all this once we obtain the vaccine, but we'll have all that.
Well, that'll solve that
Right.
problem. Good.
Okay.
So do we have an estimated budget for all of this clinic work and situation and planning? Are we looking at a subsidy from the state, or are we going to be responsible for it out of our budget?
Well, at one point, there was a vaccine line item. Sandy set it up some years ago. I don't know what happened to it. I haven't
Yes.
really looked.
Yes, that line item was moved over into revolving. Is that correct, Mallory?
Yeah. That's what you
Anyway,
guys.
it's a little over $18,000 that we have still preferred to be used for vaccination clinics. So we haven't, in our BOH budget funds, we have 18,000 plus for running clinics.
The biggest piece of your budget for running clinics, if you use mostly volunteers, the equipment, syringes, things like that. And they're not that expensive. So you're talking, $200 to $500 worth of syringes and stuff like that. So the other piece is if the board decides that they want to hire an agency to bring in nurses, then now you're talking big bucks, because I don't know. When I retired, I was up around $65 an hour. So now you're talking big bucks of, for a nurse. So anywhere between, at the bottom end would be $35. At the top end, you're talking $65 an hour. So just to throw out some numbers when we continue to mull this over and figure it all out.
Lots of details.
Mm-hmm.
Okay, so here we go. Sort of an action plan thought here. Kate's going to work on Excel, so I'll reach out to her to say we need to get going on that. Mallory, can you, before you go on holiday leave today, reach out to our first responders, police, etc., to find out who needs to get it, how many people we have. Get that list if you can, with all the details of contact information so we can reach them. All right, so that's Mallory. I will reach out to the school for the EDS clinic drill on January 11th. Judy will contact Jamie to see if that date works for her. I will reach out to Lori to get a list over to Mallory, and maybe all of us, well, however she feels appropriate to handle it. Age group 75 and older, 65 to 75, and so on. I will also ask Jill if they have the empty refrigerator to use. And Judy, you're going to contact Rich.
Right.
Okay. Did I miss anything right now for what we really need to handle in the next few days before Christmas?
Coordinating a regional clinic for the first responders. Do we want to consider that?
I'll talk to Rich about that.
All right, you
when
check
I
with
talk to him.
Rich whether he's agreeable to have our guys go there. And Mallory, will you ask our responders and police whether they would go there or not? Find out what their opinion is. So we have two things that need to be done. One, to ask Rich if it's okay. Number two, what do our people in town want to do?
Okay.
And then on the 23rd is the Quabbin walkthrough, so we can talk, Jamie will have a lot of information for us there, so that's worth going to and walking through and adding to our plans.
Right. Judy, are you going to that one?
Yep, I'll be there.
I'm also going.
Okay,
Good.
because I'm not.
We make one adjustment to that idea about the regionalization. Before we ask our first responders if they would go, could we check with Rutland to make sure they'll do it and when they have a plan and a date for a clinic? Because
that's a
gonna
good
make
idea.
Big difference. If they're gonna be able to do it next Monday and we're gonna be a month out, I can't imagine first responders would want to wait.
Right.
You know, so we need to have that data before you ask them what they want to do.
Okay.
Yeah, that's a good point, Ben. Thank you. Very good.
Okay. Sounds like
one
a
last thing,
start.
Judy.
Yeah.
Would you put together, start reaching out to nurses to see what kind of a list of actual volunteers we would have and their best days? Are they available on Saturdays? Are they available weekdays after 3:30? Maybe those two questions.
Okay. You know, having a weekday after 3:30 is an interesting concept. I like that because that could be run, you know, for 4 hours,
Yes.
you know, and catch those folks coming home from work and et cetera. So, okay, we'll work on it.
Okay. And then originally we planned on having the next Zoom January 4th. Is that correct?
Thought it was.
When was it, Mallory?
Well,
Yeah, I think it was. No, it wasn't the 4th. It was later in the week.
It was
6th, Wednesday the 6th.
Oh, Wednesday the 6th. Yes. Just looked at my calendar. Thank you.
what was
Yeah,
on the
so
Wednesday?
that's our
the 6th?
next planned Zoom meeting, okay?
for this committee,
For this purpose,
not the Board of Health
No.
No.
meeting. Okay,
That's
because
Okay.
the Tuesday.
all right, so it's January 6th.
Yep.
And what time?
10?
Same thing as today?
Yeah.
Okie dokie.
All right. Thanks, everybody.
Thank
Um,
you, guys.
Okay,
I will be a volunteer. So just put me on your,
Put you with screening. You can screen folks.
Yeah,
yeah, I can do that. I have medical background to do that.
whatever I can do, I'll be there to help. So
yeah, me too.
All right, because that's what happened in Orange. The New Salem Board of Health came on board and they actually have a nurse on their board, yay. And Orange has a nurse on their board, also yay. And they actually ran an outdoor clinic, drive-through clinic this Saturday in the cold.
Oh,
Brr.
But you know what? It worked. It actually worked. So
Great.
I was there to draw it up. So I was the nurse that drew everything up. So, and then the other nurses, gave out the shots, but it was beautifully set up and it really worked. But they also have the space to do it.
Right. FYI, because I do farmers markets, I have 2 10-by-10 pop-up tents that if we need extra exit space or something, I have 2 of those. And I might be able to come up with a couple more if we need them, just to borrow.
MRC has one.
Okay, so there's 3. Now we're up to 3.
Yep.
And maybe that's all we would need for extra stuff outside.
Well, just as an afterthought in terms of volunteers, clearly we've got a Board of Health there. The probability of all of us volunteering is very high, as well as some other people in town. Would we be able to piggyback the volunteers for these clinics with the first responders so that, it's not a whole 2 or 3 cycle situation of everybody getting vaccinated? If we have a solid core of volunteers that are going to commit to this process, and again, if we can regionalize the inoculation of the first responders, would the volunteers be able to piggyback in that same time frame, same date maybe? I'm just trying to look at things in most efficient way possible. Could we explore that with the Rutland people?
Yeah, we could do that. They might consider that with their plans as well. I don't think they've considered that with their plans, but
Yeah,
that might be a suggestion for them too.
it's just a matter of getting prepared for all of these scenarios that you got to do it the most efficient way.
Yeah. Okay.
Excellent, Dan. Good thinking.
So I'll keep plugging away and everybody else will plug away, and then we'll come up with an agenda for the next steps for January 6th.
Well, Judy, would you be amenable to having everybody submit ideas to you that you can sift through and make we may all have some similar ideas, and for the plan on the 6th, the planning date of the 6th, we could come up with a list of particulars that we've all brainstormed and not have to go through it during the meeting maybe, and something like that.
Yeah, I can look at them all and tell you what I think is reality and what is not.
Well, and duplication. We don't all want to
Right,
do the same thing, but
right. So, and I'll keep my ear out as I go to these different EDS meetings. I know there's the MRC covers 22 towns. So, I can touch base with Kathy Martin out in Sterling. I can touch base with Chris Redkey in Westminster and see how they're doing. A lot of them are really depending heavily on the Montechusett Nurse Network, and I would not, because they're not only they would not only be doing Maven and contact tracing, and then asking their nurses to take on EDS clinics, that's a lot. So I don't know how far they can go, how far they can stretch their resources.
Yeah,
So, and Neshoba's is in the same boat. They have a lot of their nurses doing Maven, and they have a lot of their nurses, but they also have a BNA group out there. And I know my BNA nurses are all saying that they're stretched to the limit because the hospitals are sending, if they go in and they have like an operation, I know I've had a couple of my patients have actually tested negative, but because of their age, they've had multiple testings just trying to get into the hospital so they can have their bypass surgery. And then when they get their bypass surgery, they're out of the hospital in 48 hours, and the VNA now picks up from there, trying to follow them up. So the VNA is picking up a lot of cases that otherwise would stay in the hospital for 4 or 5 days and now being discharged at 2. So just to keep them out of the pathways of the COVID virus. But it means that the VNAs are now stretched. So there's a lot of stuff going on that's going to impact on just who's going to be available. So I think we really do need to look at our own backyard and see who we can,
correct.
you know.
Definitely.
Just a question in the context of getting a inoculation. Do you need to be tested negative before you get the shot? Or,
No,
so you can get the shot regardless?
Only if there's no symptoms.
if you have not been exposed and, you know, or so that you're not in a potential to come down with the virus. If you had the virus or you've not had the virus, you can get it either way. So a lot of folks, that's a big question I get all the time. Now that I've had the virus, can I get the vaccine? And the answer is yes.
But if I get in line to get the shot today and I come up with a fever and some symptoms, do I get the shot or not?
If there's a potential, if you've been exposed in the last 14 days to anybody who's had COVID, you're not allowed to get the shot at that time.
Okay.
That's the only thing that's going to hold you back. And if you get the shot, you may very well get fever and myalgia and headaches. But this is just, you know, we try to explain, there's a lot of misinformation out there, and that's the big thing too, is messaging, that, you know, this is just the system responding to the fact that, you know, when I sent out I didn't send it to Hubbardston. I'll send it today, my most recent little story about vaccines to
Okay.
Mallory. So you can look it over and decide whether you want to put it on the website or not.
Any other questions from anybody? I think we have done a good job here in getting the action items that we need to address first done and moving forward. Again, Judy, as soon as you know if Rutland will let our folks go there and what date they're possibly going to have a clinic, that would be great to get to Mallory as soon as possible.
Okay.
Thanks. Thanks, everybody. Anything else?
Nope.
Anything else from you, Mallory?
I'm good right now.
Okay.
And I will be checking my emails daily while I'm out, so feel free to email if you guys need anything.
Okay. Thank you for
Thank you,
doing
folks.
that while you're off.
And Merry Christmas, folks. I'll move to
Yes.
adjourn.
Same to everybody. Merry Christmas.
Merry
Merry
Christmas, everybody.
All right.
I'll see you Judy Fobbin.
Right,
Okay.
okay. All right, bye, everybody.
Bye, everybody.
Bye.
So we need a second.